I think you will all agree with me that this has been an extraordinary 2 days. No question, I've been taking notes on the many lessons learned. We began with the white paper on what are the lessons Canada can learn from other countries around the world in terms of innovation and innovation adoption. And it occurred to me in every session, without exception, there were phenomenal lessons learned. Let me capture just a few of them. One of them being the most central importance of consumers in working and partnering with them to unleash the power of consumers and transform our health systems, but doing so by giving them the tools that they can leverage to make the very good decisions on managing health and wellness. I've completed, I think, 7 interviews since yesterday. And without exception, the one issue that it came back to over and over again was empowering and centering on consumers. So I am wildly optimistic that message across the country, from Vancouver to Calgary, to Waterloo, Ontario, have embraced some of that thinking. Even the Fitbit. I was quite thrilled with that little technology. I think we should all, probably as a center, we'll start distributing those for our next conference. Second, another important lesson is the importance of building bridges, and not just building the bridges and the relationships that lead and really feed the momentum around innovation adoption, but in doing so, removing some of the barriers. And although I don't think we talked about so many of the barriers, I think we had tremendous opportunity in the last 2 days to think about what are the bridges, where are the bridges, how do you build them, sustain them, and how does one bridge build to another. I think a third, and we heard that moments ago, is breaking that bureaucratic stranglehold sometimes we feel in terms of driving innovation adoption. Thinking about shifting cultures may in fact be the revolution. And that wasn't the first time it's been suggested to me that what you're talking about is a revolution. And quite frankly, I'm okay with that idea. Perhaps the time has come. We've heard tremendous lessons learned, I think, on the importance of leadership and, just as importantly, followership. Leveraging technology that embraces, that leaders use to leverage that fellowship, creating these teams around that innovation adoption mandate, I think can't be understated. Seeing the possibilities, using imagination, taking on the impossible, I think is probably what we're all talking about these last 2 days, and only more recently on our last panel, but with a tremendous sense of optimism. I've been often accused in some ways of being the internal optimist. I see actually no other alternative but to be optimistic. The more you focus on what is not in place, the less you seem to achieve and the more slowly things change. So I certainly agree with Dave Williams in terms of really creating the conditions in our health system for our leaders, but all our key stakeholders, on encouraging them to imagine the possibilities and do so with a tremendous sense of optimism. Leaders who want to lead, and one of the issues that raised for me was the tremendous sense of courage. When I was a chief nursing officer, I took on a rather thorny issue around models of care and how we needed to shift models of care, and a wise leader said to me, "It's simply about learning to walk through the fire. Once you're through the fire, you've made substantive progress and you continue to move forward." This afternoon we talked about creating the team of Allstars. And I would suggest in this room today and also yesterday, for those who weren't able to join us, we have a phenomenal team of Allstars, and then I'll mention a few just a moment. And I think Dennis Purcell this afternoon talked about moving from yesterday's focus on proof of concept to today's focus on proof of relevance, and really looking towards proof of reimbursement and finding ways to make viable innovation stick in our healthcare system. So I think we have exceeded our expectations as an International Center for Health, Innovation, and Leadership. I have tremendous respect for the incredible presentations we were privileged to have with us. The guest speakers were quite frankly outstanding, or as Dave Williams would suggest, shockingly excellent. Love that phrase, thinking one we should go forward. This event was really not something that Ann Snowdon put together. It was an incredible team, and what I think Mahesh Oberoi might describe as a network of Vishnus, champions that have been incredibly supportive of the work of our center, and quite frankly, without whom we simply would not have achieved what we were able to in this event and many other of our initiatives. Neil Fraser, probably the leader of the Vishnus for our center, just incredible amounts of support and energy at a moment's notice. Lisa Purdy, Dr. Cal Stiller, who wouldn't be privileged to be a chair of such a center with individuals like this, and Paul Kirkconnell from BDC, who was able to bring Dennis here today. Quite frankly, we are blessed to have these extraordinary individuals to work with us to build that momentum we need around this health innovation adoption agenda. We have a small but mighty team. Laurie Turek is probably the most formidable executive director of any organization in my entire career, and I won't share with you how many decades I'm referring to there. She's just quite frankly amazing. Roxanne Riddle, who really put together every detail, nook and cranny that's attached to our events. We also have with us a number of our volunteers and our students whose energy and enthusiasm just never seems to quit, never even seems to dip down after hours upon hours. I applaud them, and it is a tremendous privilege to work with each one of you. We have a number of students of our health sector MBA, and I would suggest that they are really our future leaders. Those are the next generation, and there's a network of those students really across Canada. We're working very hard to connect to the work of the center and create a much broader, substantive network of Vishnus, as Mahesh has helped us understand. So in closing, I would like to thank each and every one of you for joining us in this extraordinary event. I would like to invite each one of you to partner with us. As John Hammergren said this morning, everybody needs this healthcare system to be sustainable, to deliver the best quality of care in the world. If we don't happen to need that healthcare system today, we most definitely might need it going forward. And I guess as a mother of 2 children, I see it as one of my responsibilities to make sure we have a healthy, innovative health system for children. And if I'm so lucky, as Dr. Stiller has 11 grandchildren going forward. So I leave you with a couple of things, takeaway messages from this extraordinary event, is to think of ways collectively together we can harness the optimism and the imagination. We build momentum that we began with today. We build upon Canada's formidable strengths in terms of our education system, our health professionals who work in very, very challenging environments every day. You work with us, perhaps, to build that collaborative network of innovation. And collaboration is a fundamental principle for the center, whereby we each bring strengths to that table, but collectively our strengths are that much more extraordinary when they've harnessed and they've worked together. I was asked today in one of my interviews, what are some of the roles I have in this extraordinary center? And one of the ones I heard a lot about the last 2 days is really, I think it's about creating the conditions in our health system and our education system. I see those as intricately linked. Create those conditions for innovation to bubble up from the surface, recognize those opportunities for that innovation, and then build the conditions moving forward for it to thrive, fuel that innovation adoption in our health system, and then embed it into the fabric of our health system as a core business for every health professional, and consumer and family member to a sense of ownership that this healthcare system is a precious resource of Canada's and one that we should work very hard collectively and collaboratively to continue to strengthen through innovation adoption. So with those comments, I wish you well in your travels, and thank you ever so much for joining us in this extraordinary event. Good afternoon.